guests, colleagues, and fellows. To begin the 2019 induction ceremony, please welcome the President of the American Academy of Nursing, Karen Cox, President-elect Eileen Sullivan Marks, and President-elect Kenneth White.
Good evening and welcome to the American Academy of Nursing's 2019 induction ceremony. I'm Karen Cox, and it's my honor to serve as the Academy's president. The Academy's incoming president, starting tomorrow, is Eileen Sullivan Marks, and we're pleased to host this evening's celebration. We also want to acknowledge the other person on the stage, and our newly elected president-elect, so he tomorrow will become president-elect. And we are excited to recognize the dynamic individuals who tonight will become fellows of our organization. Nursing is a profession that places compassion and science at the center of our work to actively improve healthcare worldwide. The Academy's induction ceremony honors incredible nurses whose contributions have made a significant impact on individuals, families, communities, and their populations. Their work has changed lives and served as an inspiration to us all. This is a celebration of what has been achieved and what we know we will achieve together in the future. So I want to begin tonight by recognizing this year's living legends. Within the Academy, we recognize a select group of fellows whose lifetime accomplishments are so distinguished that they are truly our legends in their own time. On Thursday evening, I had the privilege of announcing these remarkable nurses whose careers have exemplified courage and commitment for real and lasting change. If you please, I ask that each of the 2019 living legends stand when I call your name. Geraldine Polly Bednash, Catherine Alicia Georges, Pamela Mitchell, Linda Schwartz, and Mary Wakefield. At this time, I would like to recognize the extraordinary leadership the Academy has been fortunate to have over the years. That leadership has come not only from the people serving on the board of directors, but from all of the fellows. The Academy has and will continue to grow because the voice and expertise of nursing is vital to improved health and wellness. First, our charter members. This inaugural cohort of fellows has guided the Academy since its beginnings in 1973, 46 years ago. We are also grateful to have a number of our past presidents in the room. Through vision, influence, and commitment to mission, their leadership of the Academy helped the profession reach new heights. I want to ask all our charter members and past presidents to stand and receive our expression for your service to the Academy. The first recognition of tonight's celebration is the 2019 President's Award. This award acknowledges an influential national leader who embodies the mission of the Academy. Our honoree tonight is being recognized for his extraordinary lifelong contributions to advancing nursing leadership and innovation. It is my honor to introduce Dr. Tim Porter O'Grady, the recipient of the 2019 President's Award. Dr. Tim Porter O'Grady is recognized both nationally and internationally as an expert and a futurist in clinical health systems, leadership, professional governance, and health systems innovation. He has consulted with over 600 clinical systems worldwide and has lectured at over 1,000 settings globally. He has authored and co-authored 26 books and over 200 journal publications, and is a 9-time winner of the American Journal of Nursing Book of the Year Award. Dr. Porter O'Grady was inducted into the Academy as a fellow in 1991 and has been recognized by the American Organization of Nursing Leadership with their Lifetime Achievement Award and by the American Nurses Association with its Luther Christman Award. Dr. Porter O'Grady's name is synonymous with quantum leadership, innovation, shared governance, transformation, and developing nurse leaders to envision a future of healthcare excellence. He blazed his own path, and our leadership capacity is better for it. So it is my sincere pleasure to present to you Dr. Tim Porter O'Grady with the Academy's 2019 President's Award.
So much ahead of us, I feel like a mosquito in a nudist colony. So much to cover and so little time. You know, trying to work through what I might say tonight, I discussed it with Mark, my husband, and he said, don't try to be too charming or too funny or too scholarly or too humble. Just be yourself. I don't know how I should take that, but there we go. I promise to be uncharacteristically brief. That's why I have notes. I want to thank you, Karen, and the board for this honor. For me, there's nothing greater an honor than being honored by your colleagues, and especially the best and the brightest colleagues. I am humbled by this honor, and I appreciate it. There are so many of you, of course, that I could thank personally, but you all know who you are. So I just want to say thank you to my many mentors, colleagues, peers, and friends who have supported my nursing journey and still do. I do want to share a couple of personal thanks. First to Mark, my life partner. For 43 years of the best example of a nurse, a friend, and a partner that I could have ever expected in this life, and I am sincerely grateful for that. And secondly, to another good friend, Kathy Malik, partner, professional writer with me, an academic and scholar partner, always pushing, always challenging, and always celebrating our nursing journey together. There's nothing better than having a good professional colleague along the way. In closing, I just want to say, when I was a young nurse, a leader colleague said to me at one time, nursing power is one of the best kept secrets in healthcare. And the only thing I could think of saying is, why? Why is nursing power one of the best kept secrets in healthcare? And that was a seminal moment for me, because my career has been devoted essentially to advocating for the power of nursing for my whole life. In structuring for nursing equity and power, in leading for empowerment, and most of all for articulating the impact of nursing's power and the price for ignoring it. And I'm thankful to have had that career. I'd like to say that this is one of the best choices I've ever made. I've never regretted the choice of becoming a nurse. Now, I've had a couple of dark days along the way, but I've never regretted the choice. Nursing closes no doors. I tell nurses who are unhappy, if you're unhappy, it's your own fault. There are 10,000 other things you can do. Nursing lies at the center of the healthcare earth. The only people who sometimes don't recognize it or forget it is us. I would do it all over again. I am grateful, and I thank you.
Before we begin our ceremony, please join me in thanking the members of the Academy's Fellow Selection Committee. Led this year by Ann Gross, David Keepnews, and Jane Swanson, This selection committee reviewed 312 applications and selected 231 new fellows. Will the members of the Fellow Selection Committee please stand? Thank you for your exceptional work in selecting what is an outstanding class of new fellows. Now, in order to move through our induction and recognize each fellow for their incredible accomplishments, we ask that you refrain from greeting the new fellows during this ceremony. I promise there will be plenty of time for continued celebration afterward. We'll be introducing these fellows according to their country or state, and weaving in the introduction of our honorary fellows as well. Please follow along in your programs, where the outstanding work of these 231 incredible nurses is included in much more depth and detail, highlighting why they are the class of 2019. Now, and also just know that we could read that whole bio that's in there, but ladies and gentlemen, we would be here till midnight at least. So please take the time to follow along and read them. And if by chance we mispronounce your name, please let us know. We practice a lot, but occasionally that doesn't work. So we want you to tell us, and we're happy then to say your name again and introduce you. Okay, here we go. Our first fellows to be inducted tonight join us from the state of Arizona. Sheila Gephardt. Dr. Gephardt's work intersects implementation science and parent engagement to shift paradigms and inform strategies to optimize outcomes in fragile neonates. Her Neck Zero tools, including Gut Check, are accessed across the U.S. and internationally to improve neonatal care. Welcome to the Academy. Michelle Gregatius Reyes. Dr. Gatius Reyes has had a sustained impact on the care of the geriatric neuroscience patient. Her leadership roles, both clinically and professionally, in organizations have resulted in sustainable quality measures to promote the clinical translation and recognition of delirium. Welcome to the Academy. Ruth Taylor Piliahe. Piliahe. Thank you. Dr. Taylor Piliahe's research focuses on Tai Chi exercise interventions to enhance rehabilitation and recover from cardiovascular disease among older adults. Her work demonstrated reduced falls for older adults with strokes after a Tai Chi exercise program. Welcome to the Academy. From the state of Arkansas, Melody Harris. Dr. Harris advances innovations in geropsychiatric nursing. Her focus on the primary care needs of the elderly in rural populations has prepared a nursing workforce ready to improve the physical and mental health of underserved older adults. Welcome to the Academy. From the country of Australia, Regina Lee. Dr. Lee's research and interventions focus on the care, health, and well-being of children and adolescents. She developed weight management and hand hygiene guidelines adopted by the nurses, teachers, and parents locally and nationally. Welcome to the Academy. Elizabeth Manias. Dr. Manias examines the complexities relating to medication, communication, medication safety and adherence, and risk management. Her work involves using innovative ways to enable patient and family engagement in an effort to promote safety and quality in healthcare. Welcome to the Academy. Jill White. Dr. White is recognized for her expertise in education, regulation, and policy in Australia as well as internationally. She led 2 international policy and research roundtables, bringing together high-level nurses from the UK, USA, Canada, Australia, and New Zealand. Welcome to the Academy. From the state of California, Kupiri Ackerman Barger. Dr. Ackerman Barger combines her expertise in nursing and education to advance a program of instruction on workforce diversity and education equity. Her research identifies the skills and knowledge that healthcare educators and leaders need to diversify the healthcare pipeline. Welcome to the Academy. Kathleen Becker. Dr. Becker has created high-level interprofessional teams that improve the health outcomes of vulnerable populations. Her interprofessional education initiatives focused on the social determinants of health and health equity has increased the capacity of primary care providers to care for the homeless. Welcome to the Academy. Rhonda Collins. Dr. Collins' research has studied nurse acceptance and adoption of mobile technologies for the purpose of patient care in acute settings. She is the visionary and the founder of the American Nurse Project that honors and amplifies the story of nurses. Welcome to the Academy. Cecilia Crawford. Dr. Crawford's work focuses on the intersection of research, service, education, and policy for the Kaiser Permanente Southern California and beyond. She is the founder and director of the Academy for Evidence-Based Practice, where she mentors others in evidence appraisal. Welcome to the Academy. Mary Delafield. Dr. Delafield has successfully integrated research, education, and practice for nurses working in the nursing home. She has advocated for evidence-based approaches to staffing, management, ulcer prevention, care planning, and balancing safety with resident choice. Welcome to the Academy. Dave Holmes. Dr. Holmes' research seeks to understand power relations between nurses and patients in settings where both groups are objects of institutional power. His ultimate objective is to understand how nurses are co-opted by institutional policies and how it impacts nursing practice. Welcome to the Academy. Susan Spencer Jacobs. Ms. Jacobs' leadership, research, and advocacy identified challenges and funding limitations constraining the health and well-being of individuals on supplemental oxygen. National clinical guidelines and policy changes to improve home oxygen therapy based on her findings are underway. Welcome to the Academy. Mary Law. Dr. Law is an expert critical care clinical nurse specialist. She has authored multiple critical care nursing textbooks that are widely used in the United States and internationally. As a research scientist, she studies family experiences in critical care. Welcome to the Academy. Tamara McKinnon. Dr. McKinnon is an internationally recognized leader in global service learning. As the director of the Alliance for Leaders in Global Humanitarian Training Program, her work focuses on program standardization and integration of ethical, evidence-based service learning programs. Welcome to the Academy. Monica McLemore. Dr. McLemore's research in reproductive health rights and justice has impact and research in policy and clinical practice. She is a nationally recognized leader in reproductive life course evaluations specific to Black maternal health. Welcome to the Academy. Donna Meyer. Ms. Meyer is a transformational leader in advancing nursing education. Recognizing that a highly educated workforce is essential to the profession's ability to lead and transform the nation's healthcare delivery system, she became a driving force for academic progression. Welcome to the Academy. Linda Park. Dr. Park has pioneered research to support patients with cardiovascular disease by testing practical, technology-based interventions to improve patient self-care, clinical outcomes, and quality of life. Her research is focused on engaging high-risk, vulnerable populations, including older adults. Welcome to the Academy. Suzanne Phillips. Dr. Phillips' expertise in health policy related to APR practice advancement has attained national and international recognition. Her annual award-winning manuscript reporting advances in APR and scope of practice has influenced regional, national, and international policy. Welcome to the Academy. Sandra Stavesky. Dr. Stavesky's research is aimed at improving outcomes of children after cardiac surgery through preventing harm they may experience during hospitalization and at home. In low to middle income countries, her focus is on pediatric cardiac ICU education and parent home care education. Welcome to the Academy. Cynthia Sweeney. As the first executive director of the Daisy Foundation, Dr. Sweeney focused on the impact of meaningful recognition of nurses across practice and cultural settings. Her leadership as a nurse and military officer significantly contributes to the profession of nursing. Welcome to the Academy. Joyce Trompetta. Dr. Trompetta's research examines organ donation, health disparities, and medical exclusion related to race and ethnicity, and reasons why people are unwilling to donate. She leads global efforts for countries to become self-sustainable towards elimination of organ transplantation tourism. Welcome to the Academy.
From the country of Canada, Ruth Martin Meisner. Dr. Martin Meisner's research has had a sustained impact on the integration of nurse practitioners in primary and long-term care. Her results have been used provincially, nationally, and internationally to inform policy on nurse practitioners' scope of practice, education, regulation, and deployment. Welcome to the Academy. Corinne Olson. Dr. Olson investigates cancer-related fatigue across cultures. She is interested in the use of shared decision-making as a vehicle for symptom management care planning that incorporates current evidence as well as the patient's beliefs and values. Welcome to the Academy. Joy Richards. Dr. Richards has advanced meaningful change for individuals living with memory loss. She has designed and implemented innovative programs with significant measurable outcomes, now replicated across Canada. Her academic research focuses on courage development. Welcome to the Academy. Dawn Stacy. Dr. Stacy's research advances the science of creating and implementing user-friendly tools to support patients' involvement in healthcare decisions. Her tools, training, and implementation resources are publicly available and used internationally to inform practice and policy. Welcome to the Academy. Gail Tomlin Murphy. Dr. Murphy is a global leader in needs-based health systems, health workforce planning, and research. She works with governments in many countries to advance health systems and workforce planning based on the healthcare needs of populations. Welcome to the Academy. Michael Villeneuve. Mr. Villeneuve is an executive, educator, knowledge mobilizer, and national voice in nursing and health policy in Canada. He is leading the implementation of an inclusive and transformative vision for intra-professional and optimal utilization of the nursing workforce. Welcome to the Academy. From the People's Republic of China, Hong Wang. Dr. Wang is the first Chinese nurse scientist to address HIV/AIDS care in China that led to intervention programs that have improved health outcomes in patients with HIV/AIDS. She has developed the first nursing IRB, that's the review board, in Hunan province. Welcome to the Academy. Li Ming Yu. Dr. Yu's research informs policy on association of nursing human resources with patient outcomes and enhances nursing policy research in China. She holds leadership roles in advancing a comprehensive nursing educational system to meet healthcare need of the Chinese people. Welcome to the Academy. Yu Shar Chung. As the first PhD pediatric nurse and pediatric nursing professor in China, Dr. Chung introduced the concept of family-centered care and promoted the practice of neonatal individual development care assessment program. She changed the maternal separation care model and trained parents to improve their discharge readiness. Welcome to the Academy. Yu Ku Chow. Dr. Chow's research addresses the effects of social factors and biomarkers on patients with schizophrenia. She is leading a National Natural Science Foundation of China study to examine risk factors in pastoral and rural areas. Welcome to the Academy. From the state of Colorado, Joanne Clavel. Dr. Clavel's contributions in leadership innovation catalyzed the Champlain Initiative, a regional community health model improving economic security, environmental health, and well-being for Vermont citizens. Her research led to the development of the professional governance scale. Welcome to the Academy. From the state of Connecticut, Christine Wazinski. Dr. Wazinski was one of the first to introduce advanced practice registered nursing practice to healthcare systems and society. As president-elect of the American Delirium Society, she is passionate about her clinical work and research related to delirium prevention, treatment, and management. Welcome to the Academy. From the District of Columbia, John David Bing, Jr. Mr. Bing's work has centered on increasing diversity within the certified registered nurse anesthetist workforce and providing humanitarian care to the most vulnerable in our society, including in Central America, while repairing children's cleft lipped and palates. For this work, he has an endowed scholarship in his name. Welcome to the Academy. Susan Forneris. Dr. Forneris is a global leader in clinical simulation and nursing education. She leads teams of educators both nationally and internationally to co-create teaching and learning strategies that build excellence in faculty development, reaching over 2,000 schools of nursing worldwide. Welcome to the Academy. Deborah LaFond. Dr. LaFond is a national leader in pediatric palliative care, implementing innovative models of care delivery to transform access to care for the 60,000 children who die annually in the United States and the 500,000 more living with serious illness. Welcome to the Academy. Colleen Lenners. Dr. Lenners, a decorated member of the United States Army Nurse Corps, has been awarded the Bronze Star for her selfless military service during war while deployed in Iraq. She created a nurse-managed primary care clinic for wounded warriors and now advances health and education policy at the national level. And Dr. Lenners' son, Staff Sergeant Paul Shirashi, United States Marine Corps, just completed a tour in Afghanistan and is here today for his mother's induction. Welcome, Colleen. Jennifer Moore. Dr. Moore's national policy leadership has resulted in a paradigm shift in Medicaid data that informs policy for vulnerable populations. Her work has focused on advancements in health services research, policies that affect women and children, and social determinants of health. Welcome to the Academy. Linda Tolley. Through her leadership, Ms. Tolley has led measurable improvements in care delivery, adaptation of technology, and nursing response to global disasters. Using philanthropic support, she has developed innovative approaches to address workforce shortages and building the workforce of the future. Welcome to the Academy. Carol Taylor. Dr. Taylor's passion in making healthcare work for all, especially the most vulnerable, a committed ethics educator, she is the designer of innovative interprofessional ethics curricula and lectures internationally on ethics and organizational integrity. Welcome to the Academy.
Each year, the Academy's board receives nominations for honorary fellowship. These individuals' professional careers have exemplified interprofessionalism with a background outside of nursing. Their induction as honorary fellows signify their outstanding contributions to healthcare and their collaboration with the nursing profession. This year, the board has selected 3 individuals for this honor. Our first honoree is Fitzhugh Mullen. Dr. Mullen has had a long history of engagement with nursing education and dedication to the U.S. and international health workforce issues, starting with a 1994 New England Journal of Medicine article he co-authored called State Practice Environments and the Supply of Physician Assistants, Nurse Practitioners, and Certified Nurse Midwives. More recently, he has served as the co-principal investigator of the Robert Wood Johnson Foundation-funded Social Mission of Nursing Education Study, and has worked to incorporate nursing in the leadership of the Beyond Flexner movement. In 2019, George Washington University renamed its Health Workforce Institute to the Fitzhugh Mullen Institute for Health Workforce Equity in recognition of his founding work and lifelong commitment to social justice, health equity, and health workforce improvement. We welcome Dr. Mullen into the Academy as an honorary fellow. Dr. Mullen is unable to attend the ceremony tonight, so Dr. Sue Hassmiller, a longtime colleague and friend, will accept on his behalf.
From Fitz. I am surprised and honored and very appreciative of this honor. My grandmother was, and my sister is, a nurse. I assure you they are surprised and honored as well. The history of nursing in the 20th century is a springboard from where nursing should go in the 21st century. From apprenticeship training to higher education to new applications in practice, management, and health system leadership, nursing has proved nimble and creative where other health professions have not. It is that creativity and that pluripotentialism, that's how you can tell these are Fitz's words and not mine, pluripotentialism, that adds such value to a dynamic growing system. Nursing needs to continue to pioneer change and improvement. Finally, nursing needs to lead in challenging the monumental health inequities that are built into health and healthcare the world over. Racism, gender, poverty, religion are all predicates of immense health disparities between and within populations. Having a passionate sense of social mission at the individual, institutional, and professional level will be essential to building systems that are not only better, but also fair. Nurses are indeed in a position to make a huge contribution in leading these global reforms. Thank you on behalf of Dr. Fitzhugh Mullen, my friend.
From the country of Finland, Helena Leino-Kilpi. Dr. Leino-Kilpi is an international European researcher known for empirical ethics, empowering patient education, and evaluation of nursing education. She has actively contributed both to the assessment of the quality of nursing research and education of new researchers. Welcome to the Academy. From the state of Florida, Christopher Blackwell. Dr. Blackwell's research and scholarship in lesbian, gay, bisexual, transgender, and queer health and social policy disparity has made significant impacts in the nursing care of this population, improving both care delivery and health outcomes. Welcome to the Academy. Annette Bourgault. Dr. Bourgault has led interdisciplinary teams to facilitate evidence-based practice changes in acute and critical care. Her research on feeding tube verification in the critically ill has transformed practice at the bedside and in nursing education. Welcome to the Academy. Terry Chanot. Dr. Chanot pioneered research in patient safety awareness among students. She developed and validated the healthcare professionals' patient safety assessment curriculum survey to advance the quality and safety education for nurses initiative to interprofessional and clinical arenas. Welcome to the Academy. Deborah Hain. Dr. Hain's research teaching, practice, and advocacy at the national and international levels has significantly improved the care of vulnerable older adults. She focuses on life-limiting illnesses for persons with chronic and end-stage kidney disease and cognitive impairment. Welcome to the Academy. Victoria Loerzel. Dr. Loerzel's research addresses self-management behaviors in older adults with cancer. She pioneered the development of avatar-based serious gaming as an educational tool to assist older adults in self-managing cancer treatment-related side effects at home. Welcome to the Academy. Deborah Kelly. Using an omics approach, Dr. Deborah Kelly investigates biobehavioral factors of cancer-related symptoms and quality of life indicators. Her research explores the temporal associations among lifestyle behaviors, the gut microbiota, inflammation, and psychoneurological symptoms throughout the cancer trajectory. Welcome to the Academy. Stephen McGee. Dr. McGee is a global health leader, actively engaging scholars and students on both sides of the Atlantic. Following a distinguished career in the British Army, his scholarly work promotes treatment for post-traumatic stress disorder among active duty military and veterans. Welcome to the Academy. Xiaolan Wang. Dr. Wang's research addresses physical activity behavior to improve self-management for moderate and severe cancer symptoms. She conducts groundbreaking work in developing and testing telehealth exercise gaming approaches for an understudied but growing population of head and neck cancer patients. Welcome to the Academy. Linda Washington Brown. Dr. Washington Brown has led multiple funded research projects addressing healthcare disparities among underserved persons within the United States and internationally by engaging nurses and the broader healthcare community to adopt policies to provide vaccinations among homeless populations. Welcome to the Academy. From the state of Georgia, Jinbing Bai. Dr. Bai's pioneering research seeks to understand the role of the microbiome gut-brain axis in psychoneurological symptoms and toxicities among children with cancer using omics techniques. His work also examines the impact of neighborhood socioeconomic and environmental deprivations on the microbiome to better understand factors underlying health disparities. Welcome to the Academy. Noreen Bernard. Dr. Bernard is a nationally recognized expert in evidence-based leadership and nursing professional practice. Her seminal contribution to nursing is the creation of a comprehensive nursing leadership development model that forms the authentic and transformational foundation for healthy work environments. Welcome to the Academy. Eve Bird. Dr. Bird is locally and nationally recognized for eliminating stigma and improving access to care for persons with behavioral health disorders. As director of the Carter Center's mental health program, she addresses social determinants through multi-sectoral interventions and community coalition building. Welcome to the Academy. Rashita Chandler Coley. Dr. Chandler Coley addresses HIV prevention for African American women by exploring communication and community-based technological modalities for the most effective milieu to to reduce health disparities through innovative research, teaching, and clinical practice. Welcome to the Academy. Michelle Dines. Dr. Dines was one of the first nurse midwives to complete the prestigious CDC Epidemic Intelligence Service. She has shaped reproductive, maternal, and child health policy and practice globally through high-level research across 16 countries in low resource, and humanitarian crisis settings. Welcome to the Academy. Dina Gilland. Dr. Gilland developed the structure for nursing practice in an ambulatory care setting, focusing on optimization and illuminating the value of nursing. She developed a pre-licensure student curriculum and residency program, contributing to the advancement of ambulatory nursing in the profession nationwide. Welcome to the Academy. Teresa Gillespie. Dr. Gillespie's research focuses on identifying and reducing cancer disparities among minorities, veterans, rural and lower socioeconomic status populations. Her work has explained the roles of education and access rather than race as drivers of cancer outcomes, including survival. Welcome to the Academy. Patricia Moreland. Dr. Moreland is a global health leader in capacity building. She contributed to the development of the first master's program in Rwanda, East Africa, graduating over 100 master's prepared nurses while integrating clinical innovation in palliative care and sexual minority health equity. Welcome to the Academy. Carolyn Riley. Dr. Riley is a cardiovascular researcher, educator, and leader. She has devoted her career to improving outcomes for persons with complex cardiac conditions through her passion for patient education, creating evidence for practice, and leadership in professional and nonprofit organizations. Welcome to the Academy. Mary Zellinger. Ms. Zellinger has advanced practice nursing through her advocacy, development, and coordination of interprofessional educational opportunities in cardiovascular critical care specialties, nationally and internationally. Her leadership in professional organizations has had a significant impact on the development of interprofessional practices. Welcome to the Academy. From the country of Germany, Christian Kugler. Dr. Kugler was the first PhD-prepared nurse clinician in organ transplantation in Germany. Her scholarly interests focus on patient-centered care for individuals and families with chronic conditions, namely those with thoracic transplantation and ventricular assist device implantation. Welcome to the Academy. From Hong Kong, William Lee. Dr. William Lee led the largest smoking cessation research team in Hong Kong. His rigorous research in the development and evaluation of smoking cessation intervention has had a strong impact on health, smoking cessation services, and governmental policies. Welcome to the Academy. Man Ping Wong. Dr. Man Ping Wong pioneered brief behavioral intervention models to treat smoking and alcohol addiction. His publications have transformed local practice models and influenced the international guidelines on better treatment for addictive behaviors. Welcome to the Academy. From the country of Iceland, Helga Bragadottir. Dr. Bragadottir emphasizes quality, safety, and global leadership of nurses. In her home country of Iceland, she is a pioneer in studying missed nursing care and teamwork and using technology in clinical nursing research and teaching. Welcome to the Academy. From the state of Illinois, Susan Weber Buchholz. Dr. Buchholz's work has informed behavior change interventions among underserved populations. Her novel work uses an adaptive design to improve physical activity adherence in women through a mobile health tool to bank bilingual physical activity text messages. Welcome to the Academy. Susan Dunn. Dr. Dunn's research addresses hopelessness and physical activity in patients with heart disease. She developed the widely used State Trait Hopelessness Scale, which has been adopted by clinicians and researchers in China, Italy, Indonesia, Korea, Pakistan, the Philippines, and the United Kingdom. Welcome to the Academy. Elizabeth Fildes. Dr. Fildes, founder of the Nevada Tobacco Users Helpline, translated her tobacco control experience into more rapid implementation of similar programs in the Philippines to support the WHO Framework Convention on Tobacco Control. Welcome to the Academy. Pardon, it's Dr. Files, like Childs. Dr. Files, I'm sorry. Thank you. Kathy Kobler. Kathy Kobler. Dr. Kobler's commitment to children is reflected through 3 decades of service to advance the fields of perinatal, neonatal, and pediatric palliative and bereavement care. Her scholarship focuses on areas often unnoticed, including the role of ritual in end-of-life care. Welcome to the Academy. Sarah Livesay. Dr. Livesay provides leadership in stroke and neurocritical care and neuroscience service. She led the development of the quality measures for neurocritical care recognized as the best practice by the Centers for Medicare and Medicaid Services. Welcome to the Academy. Susan Walsh. Building on decades of providing primary health care and service learning experience with vulnerable populations, Dr. Walsh established a nonprofit organization in 2005 to support health care for over 100,000 patients in Haiti. She is also a champion for health literacy programs in correctional settings. Welcome to the Academy.
From the state of Indiana, Asad Ahmed. Dr. Ahmed's research is focused on interventions that improve breastfeeding outcomes among low-income mothers and their preterm infants using digital health. She has tested the effects of sleep disruption during pregnancy on breastfeeding. Welcome to the Academy. Jennifer Embry. Dr. Embry has raised awareness of nurse lateral violence and its prevention in 21 countries. This work contributes to improving nursing work environment and patient outcomes around the world. Welcome to the Academy. Carol Johnson. Dr. Johnson's leadership in continuing professional development and return on investment measurement has enabled education leaders to demonstrate contributions to organizational, strategic, and financial initiatives on patient outcomes. Welcome to the Academy. Julie Ati. Dr. Ati's research and professional service has improved symptom science in nursing as it relates to poor sleep. Her outcomes have identified important gaps in research and translating research into practice to improve sleep in healthy and chronically ill populations. Welcome to the Academy. Chad Priest. Mr. Priest is a transdisciplinary humanitarian leader whose practice and teaching builds healthcare system and community resilience to disaster and crisis events. He is the only registered nurse to hold the title of CEO at the American Red Cross. Welcome to the Academy. Deanna Rising. Dr. Rising's work focuses on using interprofessional student navigation teams to impact patients at high risk for hospital readmission. Her innovative programs have been shown to reduce patient and family burden and demonstrate a positive, significant return on investment for the healthcare system. Welcome to the Academy. From the state of Iowa, Kirsten Hanrahan. Dr. Hanrahan's pioneering leadership has advanced the application of evidence-based practice and implementation science in nursing. She has made groundbreaking discoveries and disseminated innovative interventions for pediatric procedural pain management. Welcome to the Academy. From the country of Italy, Rosaria Alvaro. Professor Alvaro has had a seminal role in shaping Italian nursing education and nursing policy. She worked to establish nursing education at the academic level in Italy and in collaboration with several Italian organizations, advanced improvements for nursing discipline and practice. Welcome to the Academy. From the country of Japan, Kyoko Kamibeppu. Dr. Kamibeppu is one of the leading researchers in family nursing, perinatal mental health, and health quality of life for children and families, both nationally and internationally. Her continued efforts have promoted the Japanese government's initiatives to prevent child abuse. Welcome to the Academy. Hiromi Sanada. Professor Sanada pioneered translational bioengineering nursing research for standardizing and improving the quality of nursing care. The work that she has undertaken in the area of applying advanced technology in product development and practice is internationally recognized. Welcome to the Academy. From the state of Kansas, Linnell Pierce. Dr. Pierce is internationally recognized as the critical care expert on mechanical ventilation and sedation. Her editions of the premier mechanical ventilation nursing text has been in print for 24 years and published in English, Chinese, and Portuguese. Welcome to the Academy. From the state of Kentucky, Karen Butler. Dr. Butler is recognized nationally as an extraordinary public health nursing leader, researcher, and policy advocate in environmental risk reduction. Her innovative work focuses on reducing synergistic risk for lung cancer through elimination of exposure to tobacco, smoke, and radon. Welcome to the Academy. From the state of Maine, Nancy Takaz Brown. Ms. Brown's career is dedicated to the care of children affected by surgically amenable congenital anomalies and severe pediatric obesity. She coordinated weight management programs that include expert interdisciplinary care, combating weight bias, and promoting obesity physiology education. Welcome to the Academy. Carrie Clark. As a scholar in integral holistic care and education, Dr. Clark formulated the first scope and standards of cannabis nurse practice and presents on how oncology nurses can best support patients' medicinal use of cannabis for homeostasis and healing. Welcome to the Academy. From the state of Maryland, Carmen Alvarez. As a nationally recognized leader in equity, diversity, and inclusion, Dr. Alvarez's research addressed the unique needs of underserved survivals of adverse childhood experiences and chronic life burdens. She is leading groundbreaking research to improve psychosocial well-being among immigrant Latina survivors of adverse childhood experiences. Welcome to the Academy. Jessie Casita. Dr. Casita leads the development and advancement of self-management in implantable artificial organs and left ventricular assist devices. He created a blueprint for scientists worldwide to advance left ventricular assist device self-management science to maximize treatment outcomes. Welcome to the Academy. Yvonne Commodore Mensah. Dr. Commodore Mensah's program of research uses community-engaged research principles and epidemiological study designs with a nursing lens to improve the cardiovascular health of Africans in the United States and their counterparts in sub-Saharan Africa. Welcome to the Academy. Kenneth Dion. Dr. Dion is an entrepreneur, inventor, and scholar who holds multiple patents for his innovative critical portfolio, an e-portfolio application, and critical staffer. He oversees and teaches business innovation and entrepreneurship activities to advance healthcare locally and globally. Welcome to the Academy. Mickey Goodwin. Dr. Goodwin has built transformative alliances between academia and practice. She designed a novel approach to facilitate effective transitions from school to practice and led 2 centers for nursing excellence, focusing on the intersection of scholarship, practice, and advocacy. Welcome to the Academy. Katie Huffling. Ms. Huffling is a national leader in environmental health nursing. Her work has elevated the field within nursing and the environmental health community and ensures that nursing has a voice in critical environmental policy debates at the national level. Welcome to the Academy. Peter Johnson. Dr. Johnson is a global expert and advocate for nursing and midwifery workforce development, directing projects in over a dozen low and middle income countries, including Botswana, Mozambique, and Ethiopia. He is leading efforts with the WHO to publish the first State of the World Nursing Report in 2020. Welcome to the Academy. Margaret Keel. Dr. Keel's research incorporates basic, applied, and translational science to improve biobehavioral outcomes in children affected with complex endocrine conditions or early life stress. She is an internationally recognized expert for her research on quality of life and neuropsychological outcomes. Welcome to the Academy. Catherine Ling. Dr. Ling combines military-connected experiences focusing on veteran families, clinical background, and academic leadership into creating programs, research, and practice methods to improve primary care. She investigates integrative, non-opioid pain relief strategies for use in community settings. Welcome to the Academy. Kimberly McEltrott. Dr. McEltrott's clinical practice research and international work focuses on pediatric surgery, wound, ostomy, and burn patients. She is the founder and editor of the Journal of Pediatric Surgical Nursing and the co-director of the first cohort of DNP students from the Kingdom of Saudi Arabia. Welcome to the Academy. Marla Oros. Ms. Oros is a national leader in her work to combat our country's current opioid epidemic and has dedicated her career to leading population and community health improvement efforts to promote health equity in medically underserved communities across the nation. Welcome to the Academy. Joellen Schimmels. Dr. Schimmels is a lieutenant colonel in the United States Army Nurse Corps. She served as operations officer in charge of the 254th Combat and Operational Stress Control Unit in Afghanistan and prevention team chief in Iraq, and is an expert on military readiness and behavioral health. Welcome to the Academy.
From the state of Massachusetts, Susan DeSanto Medea. Dr. DeSanto Medea is committed to optimizing the quality of life and care for persons and families living with serious illness. As a national palliative care nurse leader, scholar, and advocate, she has created and implemented innovative palliative care education, research, and policy initiatives nationwide. Welcome to the Academy. Holly Fontenot. Dr. Fontenot's research on sexual health care, including the human papillomavirus vaccination, HIV prevention, and gender minority affirming care, has garnered national recognition. Working with national and local agencies, including the Centers for Disease Control and Prevention, she is transforming practice in this area. Welcome to the Academy. Susan Kelly Weeder. Dr. Kelly Weeder's work for the care of young adults with high-risk health behaviors is internationally recognized. Working with an interdisciplinary team, her interactive, competency-based modules on substance abuse screening and referral increases accessibility to early treatment in substance use disorders. Welcome to the Academy. Maria Van Pelt. Dr. Van Pelt's research focuses on the impact of adverse events on healthcare providers and their ways of coping. Serving as a consultant to institutions nationwide, she has advanced the science by incorporating emotional peer support as an essential component of patient safety in healthcare. Welcome to the Academy. From the state of Michigan, Dina Costa. Dr. Costa's novel research focuses on maximizing survival for mechanically ventilated adults by improving the interprofessional team's ability to deliver high-quality care. Her nationally and internationally recognized work has transformed quality in critical care. Welcome to the Academy. Mahir El Masri. Dr. El Masri's research focuses on the prevention and self-management of lifestyle-related chronic illnesses with focus on ethno-cultural and socioeconomic disparities. As an international scholar, he collaborates widely with practice leaders across disciplines and in policy. Welcome to the Academy. Andrea Klein-Tilford. Dr. Klein-Tilford is a recognized leader nationally for her work to improve the health of acute and critically ill children. She collaborates on investigations focused on prone positioning in children with acute lung injury, sedation during mechanical ventilation, as well as on delirium following congenital heart surgery. Welcome to the Academy. Laurie Lozon-Clabo. Dr. Lozon-Clabo's leadership of 2 national initiatives has led to the establishment of the first nationally recognized common competencies for advanced practice registered nurses and the first common taxonomy for competency-based education accessible to nurses, interprofessional partners, regulators, and the public. Welcome to the Academy. Sarah Stoddard. Through research, community-based partnerships, and school linkages, Dr. Stoddard has advanced substance use prevention through interventions that enhance future expectations and school connectedness among vulnerable youth populations. Welcome to the Academy. Ruth Zielinski. Dr. Zielinski's program of research focuses on global maternal and sexual health. She currently leads a project in a South Sudanese refugee community in northern Uganda, where over 100 women have completed doula training, resulting in improved maternal outcomes. Welcome to the Academy. From the state of Minnesota, Diana Drake. Dr. Drake's work is at the intersection of women's health, teaching, policy, and advocacy with a focus on racial and gender disparities. She is recognized for helping to shape clinical practice and teaching through the creation of interprofessional and integrative practice models. Welcome to the Academy. Susan Jeska. Dr. Jeska leads pioneering work in the development of nurse leaders with high potential to fill executive positions across the country. This work has expanded nursing capability and has promoted the business of healthcare. Welcome to the Academy. Stephanie Whitwer. Dr. Whitwer's leadership has advanced primary care and team-based models across the Mayo Clinic 5-state primary care practices. In this model, nurse care coordinators manage the most complex and vulnerable adult and pediatric patients. Her success has led to low readmission rates and lower overall cost of care. Welcome to the Academy.
Our second honorary fellow this year is Annette Sobel. Annette Sobel is a researcher and scientist focused on the integration of biomedical innovation and human factor principles into a wide range of interprofessional solutions for humanitarian and disaster medicine challenges. During her time as a former Major General in the Arizona Air National Guard, she led a telemedicine demonstration program that promoted nurse-led care in the air in C-9 aircraft. This demonstration was the first operational technology simulation of the real-world aeromedical environment. Her contributions to telemedicine technology are now the standard of care for civilian and military transport worldwide. Dr. Sobel is also an adjunct professor in the School of Nursing at Texas Tech University Health Sciences Center, Lubbock, teaching bioinformatics to doctoral nursing students. We welcome Annette Sobel into the Academy as an honorary fellow.
Well, good evening, everyone. It's so delightful to be here, and it's amazing for me to be in front of a group of people that I don't have to actually salute, so that's very nice. When I started my career in the United States Army in the late 70s, and then my first position of leadership was as the director of the OBGYN nurse school at Fort Bragg, I knew I was in for an exciting career. And at this point in my career, all I can do is thank everyone who has helped make the opportunities and my accomplishments a reality. As all of you know who are here as new fellows and all of you who are so accomplished, everything in life that you do that is really significant requires teamwork. And I've tried to live by that my entire career. I've been very fortunate to, during my time in the military and now as a civilian, as a teacher and leader, to have many students that I can also share a lot of my experiences with, and also my basic philosophy is that everything in life that is capacity building also relies heavily on diversity and respect. And to that end, I want to thank every one of you for making it possible for me to be here tonight, and most especially my husband. Thank you.
From the state of Missouri, Ann Fish. Dr. Fish's research partnership in Nanjing, China led to an 8-year cultural and visiting scholar exchange focusing on self-management and diabetes complications, resulting in marked increases in the number of Chinese people who obtain diabetes education. She encourages the use of evidence-based practice to enhance Chinese nurses' expert power. Welcome to the Academy. Carol Kemper. Dr. Kemper is nationally recognized for her risk assessments that improve patient safety through strengthened patient-family partnerships. Her research on nasogastric tube placement in infants was the largest of its kind to evaluate the use of specific pH measurement to assess feeding tube placement. Welcome to the Academy. Beth Lyman. Ms. Lyman's leadership led to the development of the New Opportunities for Verification of Enteral Tube Location, or NOVEL, project. Her work in this area is highly recognized for its international, interdisciplinary, and inter-organizational focus that promotes evidence-based safe practice in nutrition support for children. Welcome to the Academy. Karen Moore. Dr. Moore's leadership and focus on cultural humility, health equity, service, and social justice has supported medically underserved communities locally and globally. She led the establishment of a nonprofit that provided habitable housing for 300 families, clean water, and healthcare access. Welcome to the Academy. Angeline Peters-Lewis. Dr. Peters-Lewis is nationally recognized for her work to design innovative models of care to improve the health of underserved populations. She secured the baby-friendly designation at Women and Infant Hospital, ensuring that 90% of babies and mothers in Rhode Island received care in an environment positioning them for better health. Welcome to the Academy. Joan Smith. Dr. Smith's clinical expertise, research, and leadership has transformed neonatal nursing worldwide. Her extensive body of work focuses on the integration of family-centered and neurodevelopmental care in neonatal intensive care units and the application of implementation science to improve and sustain neonatal pediatric care. Welcome to the Academy. From the state of Montana, Charlene Winters. Dr. Winters is a leader in the advancement of rural nursing science, practice, and research. Her work spans the state, regional, and national levels to investigate the effects of chronic illness of rural dwellers and the health outcomes of persons exposed to catastrophic environmental events. Welcome to the Academy. From the state of Nebraska, Ami Haddad. Dr. Haddad is nationally recognized for her work in healthcare ethics. She co-led the groundbreaking Legacy Project, documenting the contributions of leading nurse ethicists across the country. Her leadership led to the establishment of a certification exam for healthcare ethics consultants. Welcome to the Academy. From the state of Nevada, June Cho. Dr. Cho developed a groundbreaking method for collecting saliva from very low birth weight preterm infants to measure testosterone and cortisol levels. Her research seeks to establish testosterone and cortisol as hormonal biomarkers for infant health and development, mother-infant interactions, and maternal health and lifestyle behaviors. Welcome to the Academy. Linda Silvestri. Dr. Silvestri is a leader in providing global educational resources as she strives for excellence in publication quality based on the discovery of new knowledge in nursing and standards of care. Her research focuses on a holistic investigation of predictors leading to success on the nursing licensure examination. Welcome to the Academy. Rachel Ten. Dr. Ten is a global expert in depression and mental health who has worked to decrease the stigma of depression and mental health treatment in the Philippines and Nevada. He implemented a novel, multifaceted, systems-based approach that resulted in legislative and policy change. Welcome to the Academy. From the state of New Hampshire, Jean Coffey. Dr. Coffey is a recognized leader for her clinical work and research focused on caring for children and their families. Her metasynthesis, parenting a child with chronic illness, continues to be cited by researchers around the globe, and her innovative work with engaging children has changed practice. Welcome to the Academy. From the state of New Jersey, Sherry Greenberg. Dr. Greenberg is an expert in gerontological nursing, where her research has focused on fear of falling among older adults as it relates to their neighborhood-built environment. She is the editor-in-chief for the Try This series that promotes evidence-based approaches to care of older adults. Welcome to the Academy. Lauren Harden. Ms. Harden is a pioneer in the developing field of complex care. She created an award-winning complex care center model that is being adapted across the country and leads partnerships and curriculum development, improving care for vulnerable populations. Welcome to the Academy. Mary Johansson. Dr. Johansson investigates modifiable work environment factors that reduce adverse patient and nurse outcomes. Based upon her research of a practice model empowering nurses to influence resource allocation in their organizations, this model is in use statewide and is being replicated nationally. Welcome to the Academy. Jeffrey Kwong. Dr. Kwong has transformed care for persons living with and at risk of HIV infection. He has developed nurse-led models of care for vulnerable populations, including the first nurse-led interprofessional program for lesbian, gay, bisexual, and transgender older adults. Welcome to the Academy. Nancy Pontes. Dr. Pontes implemented an award-winning and innovative Spanish for Health Professions program to improve health equity and safety among persons with limited English proficiency. Her research addressing adolescent victimization, suicidality, and gun-carrying behaviors has received national and international recognition. Welcome to the Academy. Charlotte Thomas Hawkins. Dr. Thomas Hawkins, pioneering research on the nephrology nursing workforce in dialysis units led to an historic change in federal dialysis staffing policy to either a licensed practical nurse or a registered nurse supervision of patient care to registered nurse supervision models only in U.S. dialysis facilities. Welcome to the Academy.
From the state of New York, Michael Ackerman. Dr. Ackerman is a pioneer in critical care and advanced practice nursing. His innovative work has led to significant changes in how critical care patients are managed through his research on sepsis, airway management, and hemodynamics. Dr. Ackerman's innovation work has led to health system change. Welcome to the Academy. Aliza bin Zachariah. Dr. bin Zachariah's research investigates modifiable risk factors in multiple sclerosis or MS. She has transformed nursing practice by bringing the critical patient perspective to improved shared decision-making with the aim to improve the clinical outcomes of patients with MS. Welcome to the Academy. Kenrick Cato. Dr. Cato is pioneering the use of electronic health data in informatics research to support clinical decision-making, explicitly nursing data in predictive analytics. He leads nationally recognized research efforts to advance contextual decision support at the bedside, with potential to improve patient outcomes internationally. Welcome to the Academy. K.C. Clevenger. Dr. Clevenger's groundbreaking research investigates patient-reported outcomes integrated into electronic medical records to improve clinical decision-making and predictive modeling in cancer care. Her work with infants, children, and adolescents led to the development of a pediatric assessment instrument used internationally. Welcome to the Academy. Maya Jukic. Dr. Jukic is recognized for her groundbreaking research to discover quality and safety education gaps and create innovative virtual technology solutions to close those gaps and prepare nurses for emerging practice roles in the value-based care paradigm nationally. Welcome to the Academy. Mary Garcia Dia. As an informatics expert, Dr. Garcia Dia's work has addressed health inequity among minorities. Her advocacy of community-urban health addressed underrepresentation of minority health in research, equitable health policies, and access to healthcare services, impacting over 80,000 Filipino-American families in New York. Welcome to the Academy. Donna Hallis. Dr. Hallis, a nationally recognized expert in pediatric primary care, focused on combating childhood disparities in oral systemic healthcare. She established the first nationally recognized interprofessional collaborative clinical model engaging dental students, residents, and pediatric nurse practitioner students in clinical experiences assessing and treating children. Welcome to the Academy. Robin Toft Klar. Dr. Klar's health workforce capacity building in Africa has built a robust global south-to-south network of nurse leaders. These leaders are developing the next generation of nurse leaders who are addressing every aspect of the United Nations Sustainable Development Goals. Welcome to the Academy. Wilhelmina Manzano. Ms. Manzano is recognized for her transformational leadership and innovation. She successfully partnered with Columbia School of Nursing to develop nurse leaders with emphasis on care coordination and jointly funded a nurse researcher program which enhanced nursing's research strength and capabilities. Welcome to the Academy. Wanda Montalvo. Dr. Montalvo has worked extensively with federally qualified health centers, primary care associations, federal and private organizations to decrease health disparities among at-risk populations across the country. Her current aim is to advance doctoral nursing scholarship and leadership at Jonas Nursing and Veterans Healthcare, part of Jonas Philanthropies. Welcome to the Academy. Priscilla Priscilla Sega. Dr. Sega is an expert in transcultural nursing whose work has local, national, and global impact. Her contributions to culturally competent care and the influence of culture on health, well-being, and nursing care has application in theory and models of care. Welcome to the Academy. Arlene Smaldun. Dr. Smaldun's novel research bridges several clinical disciplines: nursing, dentistry, pediatrics, and bioinformatics. Her work has advanced evidence-based practice and education, improving healthcare for children with chronic health conditions, particularly diabetes, sickle cell disease, and early childhood dental disease. Welcome to the Academy. Maria Vazina. Dr. Vazina pioneered a specialized program called Standard Work to Achieve Relationship-Centered Care, or STAR, embedding Lean Six Sigma principles within a professional practice model, transforming nursing workflows to improve care, and created the first Institute for Healthcare Improvement age-friendly unit in New York City. Welcome to the Academy. Dorothy Houlihan. Dr. Houlihan's groundbreaking work in palliative care for veterans has significantly advanced care and education in the United States. She has advocated for education and led policy in palliative care throughout the United States, Kenya, Singapore, and the Philippines. Welcome to the Academy. Lynette Wolford. Dr. Wolford's innovations in clinical education model successfully integrates nurse-led initiatives as solutions for healthcare's toughest challenges, regionally, nationally, and internationally. Her model has produced new competency standards for the profession and positioned nursing as leaders in health professions education. Welcome to the Academy. From the country of New Zealand, Denise Wilson. Dr. Wilson's pioneering research focuses on Maori indigenous family violence, access to health and social services, as well as cultural responsiveness. A leading researcher in indigenous family violence, she contributes to policy and practice changes needed to respond to Maori more effectively. Welcome to the Academy. From the state of North Carolina, Donna Biederman. Dr. Biederman is a recognized national leader focusing on the intersection of health and housing. She leads a transitional care program for homeless persons and routinely contributes to decisions affecting health and housing at the local, state, and national levels. Welcome to the Academy. Jane Blood Siegfried. Dr. Blood Siegfried's research is focused on advancing nursing practice globally. She's involved in improving the ability of nurses in low-resource countries to build capacity and provide primary health care to underserved populations. She is developing a family nurse practitioner program in Tanzania. Welcome to the Academy. Margaret Bowers. Dr. Bowers is highly recognized for her innovative model for acute cardiovascular care that increases patient access and has demonstrated improved patient satisfaction and quality of life. Her leadership led to the expansion of this model for patients in skilled nursing facilities at risk for hospital readmission. Welcome to the Academy. Jada Brooks. Dr. Brooks is a pioneer for her work to collaborate with community, clinical, and academic partners locally, regionally, and nationally. She designs and implements research that both fosters health equity and empowers American Indian tribal communities to reclaim their health and wellness. Welcome to the Academy. Kelly Stamp. Dr. Stamp is a local, regional, and national leader in improving outcomes for heart failure patients. With greater accuracy of diagnosing, her research is helping to ensure patients will receive appropriate evidence-based treatments at the optimal time of their disease class. Welcome to the Academy. Eleanor Stevenson. Dr. Stevenson raises professional and public awareness about infertility through her multidisciplinary and international research focusing on the patient experience. Her team science approach has resulted in the creation of an online patient portal to meet informational psychosocial needs of those with infertility. Welcome to the Academy. Mark Tolles. Dr. Tolles focuses on care of seriously ill older adults and their caregivers. He conducted detailed case studies of discharge planning in nursing homes and developed Connect Home, an innovative model of transitional care for older adults in nursing homes and their family caregivers. Welcome to the Academy. Jarwang Wu. Dr. Wu conducts research on the many dimensions of medication adherence, focusing on consequences of poor adherence and low health literacy in older adults with heart failure. Dr. Wu develops and tests literacy-sensitive interventions to improve and sustain medication adherence. Welcome to the Academy. Meg Zomarodi. Dr. Zomarodi designed an interprofessional population health model that partners the existing workforce and interprofessional student teams to address clinical problems through quality improvement initiatives. This nationally recognized model links clinical practice and education through collaborative partnerships. Welcome to the Academy.
From the country of Norway, Wenche Karin Mamedal. Dr. Mamedal was the first in Norway to do research specifically on elder abuse and neglect in nursing homes. Her groundbreaking research has been instrumental in building a strong scientific base in the area of elder abuse, especially in Norway, but with an international presence and impact. Welcome to the Academy. Karen Jones Bankston. Dr. Bankston is a passionate advocate for the enhancement of an educated, culturally aware, and diverse workforce, having co-led the national study on holistic admissions. Her research has focused on improving the health and well-being of underserved populations, which impacted policy, practice, and education. Welcome to the Academy. Beth Clayton. Dr. Clayton's national evidence-based obstetric anesthesia guideline development, closed malpractice claims analysis, and initiatives to reduce peri-anesthesia opioid use have decreased morbidity and mortality with significant national impact. Welcome to the Academy. Beth Feynman. Dr. Feynman is an exemplary leader and researcher in the myeloma community who brings critical knowledge to providers on a local and global scale. She co-created international myeloma nursing care guidelines disseminated through innovative educational initiatives and publications. Welcome to the Academy. Kelly Hancock. Dr. Hancock, a leading nurse executive, works to achieve established financial, operational, and clinical goals in the Cleveland Clinic Health System, exemplifying nurse leadership to achieve a best-in-class workplace. Welcome to the Academy. Molly McNett. Dr. McNett has advanced the science and practice of critical care for patients after devastating neurological injury. Her research has generated evidence for optimal nursing interventions, and she leads international interdisciplinary teams in evidence-based guideline development to improve patient outcomes. Welcome to the Academy. Patricia Sharpnack. Dr. Sharpnack has substantially contributed to health policy and quality and safety through the transformation of organizational cultures, emphasizing bedside and team training innovation. She is a recognized leader in workforce development programs that advance diversity in nursing. Welcome to the Academy. Sandra Sidlecki. Dr. Sidlecki, an early proponent of common sense approach to pain management that included the use of complementary therapies such as music, she has changed pain management practices nationally and internationally through her presentations, publications, and media interviews. Welcome to the Academy. Mary Sitterding. Dr. Sitterding has transformed quality and patient safety in 3 major healthcare systems. Her award-winning research has shaped nursing nationally through application of the nurse situation awareness model, transitions to practice optimizing virtual reality, and accreditation of nursing educational institutions. Welcome to the Academy. Sharon Rona. Dr. Rona's innovative and nationally recognized work focuses on pediatric pain management and the impact of mental health. Her longstanding service and leadership in the field has focused on multimodal treatment of pain while ensuring safe and effective care for patients. Welcome to the Academy. From the state of Oregon, Asma Taha. Dr. Taha's humanitarian outreach has significantly affected pediatric nursing globally. She has presented on topics such as building global nursing education capacity, rebuilding health post-conflict, a dialogue for the future, nursing education challenges post-conflict, and global health equity in countries such as Jordan, Lebanon, United Arab Emirates, India, Jamaica, Panama, and Australia. Welcome to the Academy. From the state of Pennsylvania, Teresa Brown. Dr. Brown is a nationally known nurse writer. She is a frequent contributor to the New York Times and CNN.com opinion pages, and her book, The Shift, One Nurse, 12 Hours, 4 Patient Lives, was a New York Times bestseller. Her work has elevated nursing in the public eye. Welcome to the Academy. Linda Jacobs. Dr. Jacobs is a founding director of the Cancer Survivorship Programs at the University of Pennsylvania Abramson Cancer Center. the first adult cancer survivorship program in the country. She also developed the Oncology Nurse Practitioner Program at the Penn School of Nursing with living legend Dr. Ruth McCorkle. Welcome to the Academy. Tamara Kerr. Dr. Kerr has generated and synthesized knowledge in quality care, patient safety, and nurse health and safety. Her longstanding leadership, innovation, and service in nephrology nursing, academia, and health systems has had a significant impact on delivered care and outcomes. Welcome to the Academy. Joyce Nestrick. Dr. Nestrick is a nationally recognized leader within the nurse practitioner community, having a strong focus on the health of vulnerable populations. Specific to the opioid epidemic, she testified before Congress on the ability of advanced practice registered nurses to prescribe medication-assisted treatments as president of the American Association of Nurse Practitioners. Welcome to the Academy. William Lorman. As a leader in the addiction treatment field, Dr. Lorman has shared his knowledge, skill, and experience both academically and as a past president of the International Nurses Society on Addictions and as current president of the Pennsylvania Peer Assistance Program for Nurses. Welcome to the Academy. Ruth McDermott Levi. Dr. Ruth McDermott Levi's teaching, research, and advocacy addresses health vulnerability related to immigration, health access, and environmental exposures. Her leader in the health impacts of climate change has influenced nurse education and practice in the United States and internationally. So it's Dr. Levy. So go back. Ruth McDermott Levy. Welcome to the Academy. Cheryl Mee. Ms. Mee enhances the health of the underserved by providing support for Native American nursing students and a health-focused cultural exchange program. Her thorough assessment and creativity enhance the education of the nursing students, the health of elementary students, and the cultural perspective of the volunteer nurses. Welcome to the Academy. Barbara Patterson. Dr. Patterson's research focuses on creating evidence for teaching and for academic leadership. She influences nursing education practice, knowledge development, and evidence-based faculty development through advancing research in nursing education, advocating research priorities, leadership, and the dissemination of findings. Welcome to the Academy. Deborah Thompson. A pioneer in quality and safety, Dr. Thompson has advanced safety science and impacted healthcare policy through improved methods to reduce adverse outcomes, improve transparency, and care redesign. She has had significant impact on developing leaders in pursuing zero harm. Welcome to the Academy. Kimberly Trout. Dr. Trout's groundbreaking work is focused on the national and global crisis of elevated maternal mortality ratios, as well as a worldwide increase in obesity and diabetes. Her research has focused on optimal care during pregnancy that can prevent not only pregnancy complications, but also prevent future chronic health conditions among vulnerable women. Welcome to the Academy. Charlotte Wool. Dr. Charlotte Wool pioneered perinatal palliative care research through detailed and sustained examination of parental experiences of childbearing loss. Her commitment to these families and nurses caring for them has been transformative, making her name synonymous with perinatal palliative care. Welcome to the Academy. Jennifer Yost. Dr. Yost's research focuses on enhancing the transfer of research for informed healthcare decisions through the design, synthesis, testing, and evaluation of implementation interventions. She has improved knowledge and skills for research use among healthcare professionals worldwide. Welcome to the Academy. From the country of the Republic of Korea, Eun-hee Kang. Dr. Kang has made a significant contribution to the expansion of nurses' position by introducing the advanced practice nursing role to Korean nursing, establishing an interdisciplinary major of global health at the university level, and collaborating globally to advance nursing in developing countries. Welcome to the Academy. From the state of Rhode Island, Stephanie Chaffee. Mrs. Chaffee's innovative efforts in creating alternative models of healthcare for vulnerable population has changed the face of healthcare in Rhode Island and across the country. She had co-founded the Woman Ending Hunger program, where the importance of nutrition was taught to underserved populations. Chaffee. Stephanie Chaffee, welcome to the Academy. Thank you. Diane Martins. Dr. Martin's advocacy and outreach on behalf of vulnerable populations experiencing hunger and homelessness is highly recognized. She created programs whereby homeless, disabled, and older adults access prepared food with their Supplemental Nutrition Assistant Program. Welcome to the Academy. From the state of South Carolina, Felicia Bowen. Dr. Bowen's translational research on childhood asthma has resulted in significantly improved access to care and reduced disparities in urban minority children. Her current research aims to investigate chronic stress experienced by minority children and asthma symptoms and severity. Welcome to the Academy. Deborah Hopla. Dr. Hopla's longstanding leadership as a nurse practitioner and educator has impacted colleagues, students, and healthcare with removal of barriers to practice for nurse practitioners. With expertise in rural health, pain management, and women's healthcare, she was appointed by the Governor of South Carolina Advisory Committee on Nursing. Welcome to the Academy. From the country of Spain, Maria Teresa Moreno Casbas. Dr. Moreno Casbas' research addresses models of care for elderly, chronic, and frailty persons and nursing staff ratios for these groups. Being the leader of Spain's National Nursing and Healthcare Unit, she has had a significant effect on nursing research nationally and internationally. Welcome to the Academy. From the Sultanate of Oman, Omar Al Rashfasha Fa. Dr. Rorafash's leadership and scholarship has significantly impacted the development of nursing faculty, programs and workforce and practice in different countries in the Middle East. He is a known advocate of infection control through his research and mentorship of faculty and students in this area. Welcome to the Academy.
Our third honorary fellow this year is Perry Rosenfeld. Perry Rosenfeld is a sociologist and health services researcher that has devoted her 30-year career to studying aging, the nursing workforce, and nursing care across hospital and home community care settings. Dr. Rosenfeld's commitment to nursing is evidenced in the more than 80 peer-reviewed articles and book chapters she has published, and almost 2/3 of which include RN co-authors, and the over 100 conference podium presentations on nursing topics at premier conferences such as the American Public Health Association, the Gerontological Society of America, and Academy Health. Dr. Rosenfeld is an adjunct professor at the NYU Roy Myers College of Nursing. We welcome Perry Rosenfeld into the Academy as an honorary fellow.
Good evening, everyone. As a new graduate of a PhD program in medical sociology, I literally stumbled unwittingly into the world of nursing, and it was the best decision I never made. Over 3 decades, not that old, I've been privileged to work and learn from extraordinary nurses doing extraordinary work in federal and local government agencies, in universities, and in non-for-profit agencies, as well, of course, of those in patient care services in all of the different healthcare delivery system sectors. Being recognized by my nursing colleagues is a truly great honor, and I thank the Academy, and I also thank all the nurses who have welcomed me as one of the tribe. Thank you very much.
From Taiwan, Ching-Min Chen. Dr. Ching-Min Chen is the only nurse legislator in Taiwan. She endeavors to promote policymaking for people's health and professional nursing development. She serves in many nursing organizations to promote nursing roles in community geriatrics and long-term care. Welcome to the Academy. Ru Chow. Dean Chow actively promotes international collaborations worldwide. As the Mental Health Nurses Association president, she pioneered home mental health care and related policies. Her contribution to nursing research has earned her the 2018 Sigma Theta Tau International Nurse Researcher Hall of Fame Award. Welcome to the Academy. Yunfang Sei. Dr. Sei's research highlights the needs of minority populations in Taiwan. Her research informs practice in persons with mental illness, HIV/AIDS, alcohol addiction, and older adults about their living experiences, stressors, and how to maximize their quality of life. Welcome to the Academy. Sai-Jer Wang. Dr. Wang's research in symptom management and healthy lifestyles have contributed to nursing science and benefited patients with chronic conditions. Her policy work has contributed to the establishment of the first nurse practitioner education, certification, licensure, and continuing education program in Taiwan. Welcome to the Academy. From the state of Tennessee, Pamela Jones. Dr. Jones is a nationally recognized administrative expert on advanced practice provider innovation, business planning, leadership, and empowerment. A major focus has been her successful mentoring and development of other executive nurse leaders and her connection to community partnerships, especially with vulnerable populations. Welcome to the Academy. April Kapu. Dr. Kapu is highly regarded for her work at the state and national level to remove barriers to advanced practice, registered nurses, and the mitigation of the opioid epidemic. She was on the Governor's Commission for Pain and Addiction Management, which led to the establishment of core competencies for Tennessee's educational institutions. Welcome to the Academy. Lisa Lindley. Dr. Lindley's research influences state as well as federal policies and practice to improve end-of-life care for children. Her groundbreaking research examines the effectiveness of a regulatory mandated hospice intervention versus a standard hospice care to improve pediatric and family outcomes. Welcome to the Academy. Jennifer Wilbeck. Dr. Wilbeck's efforts defining the emergency nurse practitioner role resulted in development of national practice standards and creation of an emergency nurse practitioner specialty certification board examination. Emergency nurse practitioner educational program standards are based on her work and are now utilized across the country. Welcome to the Academy. Maria Dannett Lapis-Bloom. Dr. Lapis-Bloom's programs of science contribute to the understanding of stress-related mechanisms in mental health disorders and the empowerment of veterans and Filipino Americans to engage in patient-centered outcomes research. She has disseminated the patient safety movement, team steps, nationally and globally. Welcome to the Academy. Catherine Daniel. Dr. Daniel provided nurse-focused leadership on multiple panels as part of the American Geriatrics Society, which authored white papers focused on multi-morbid older adults, feeding tubes in patients with advanced dementia, and most recently, healthy aging. Welcome to the Academy. Nancy Downing. Dr. Downing's research focuses on improving healthcare outcomes for persons impacted by interpersonal violence through examining nationwide trends, post-traumatic stress disorder, as well as alternate light sources and bruise visibility. Dr. Downing is the first nurse appointed to the Texas Forensic Science Commission by the governor. Welcome to the Academy. Anasita Fadol. Dr. Fadol is a nursing pioneer in the evolving field of cardio-oncology and the development of this specialty. Her program of research in cancer and cardiotoxicity included the validation of the MD Anderson Symptom Inventory Heart Failure Instrument, which was subsequently translated into Chinese, Spanish, Portuguese, and Korean. Welcome to the Academy. Kathleen Fraser. Ms. Fraser is a pioneer in the practice of integrating behavioral and physical health in case management for all disease states. She is nationally and internationally known for her work on transitions of care, social determinants, and ethics for case managers. Welcome to the Academy. Carol Howe. Dr. Howe is a national leader across disciplines in diabetes education, barriers to self-management for children, and health literacy of parents. Her most recent intervention research promotes the health literacy of persons with prediabetes and e-health literacy of teens. Welcome to the Academy. Karen Johnson. Dr. Johnson is nationally recognized for her work to address health and social disparities among youth from historically marginalized groups, particularly students in alternative high schools. She explores the role of school nurses in promoting health and addressing health disparities in underexplored settings. Welcome to the Academy. CU Sylvia Lee. Dr. Lee is an expert in stress-related symptoms management among women in a variety of health contexts across the lifespan. In order to promote resilience and to optimize individual and family well-being, her innovative research has improved the nursing care mothers and their medically fragile children, both nationally and internationally. Welcome to the Academy. Jana Lesser. Dr. Lesser is an expert in community-based health promotion research and programs. Her vast community engagement has helped support inner-city dwelling adolescent mothers and fathers, disenfranchised youth, impoverished communities, as well as individuals and groups living with chronic and severe mental illness. Welcome to the Academy. Kathy Rosmus. Dr. Rosmus' research focuses on health behaviors and interprofessional ethics education. She was instrumental in the development of an acclaimed documentary on ethics and the role of nurses in Nazi Germany that has been viewed by international and national audiences. Welcome to the Academy. Diane Santamaria. Dr. Santamaria's research investigates novel, person-centered HIV prevention and sexual health interventions that use shared decision-making strategies and mobile technologies to address behavioral change and the social determinants of health among vulnerable youth populations, including those experiencing homelessness. Welcome to the Academy. Mary Teets. Dr. Teets implemented one of the first bedside computer systems in the United States using barcode-based medication administration. She has overseen implementation of telemedicine carts, simulation exercises, and remote patient management learning modules. Welcome to the Academy. Carol White. Dr. White's research examines interventions that optimize outcomes for people living with chronic neurological conditions and their family caregivers. Her national and international impact leading a family caregiving program is improving quality of life for families living with dementia. Welcome to the Academy. Julie Zuniga. Dr. Zuniga's research investigates self-management, multi-morbidities in underserved populations, and she is currently testing a model of self-management for persons living with the dual diagnosis of HIV and diabetes. Additionally, she leads an international team of nurses that aims to expand the nursing research capacity in Kenya. Welcome to the Academy. From the country of Thailand, Patraporn Tungpan-Kum. Dr. Tungpan-Kum leads a multidisciplinary international team studying related mental health issues in Asia, Australia, and the United States. She developed a new model of caregiving skills to enhance effective care of persons with schizophrenia at home. Her work is impacting evidence-based practice across the country and the Asia-Pacific region. Welcome to the Academy.
From the United Kingdom, Tommy Dickinson. Dr. Dickinson's significant research is concerned with diversity and inclusion in healthcare, taking a contemporary and historical perspective to improve the delivery of healthcare and the patient experience. His award-winning book, Curing Queers, exposed harmful gay cures, placing this neglected subject onto national and international policy agendas. Welcome to the Academy. Brendan McCormack. Professor McCormack's research focuses on person-centered practice applied to healthcare. He has developed models, theories, and frameworks for policy and practice. He has led the implementation and evaluation of person-centered practices in a variety of clinical settings and in healthcare curricula. Welcome to the Academy. From the state of Utah, Jan Joan Shank. Dr. Joan Shank pioneered competency-based nursing education nationally, serving students in all 50 states. Her research and college debt has influenced strategies for academic progression, and her work in social and emotional learning is recognized by the Gates Foundation for Innovation. Welcome to the Academy. Chris Carlson. Dr. Carlson is the author of the internationally implemented neonatal post-resuscitation stabilization course, the STABLE program. Her program serves 23 disciplines and has transformed the practice of neonatal care throughout the world. Welcome to the Academy. Jane Lassiter. Dr. Lassiter is an active advocate for the promotion of a cultural sensitivity and improved health for underserved populations often overlooked in healthcare policy and research. She leads student and nursing partnerships in remote areas of the South Pacific, Jordan, and Greece. Welcome to the Academy. Andrea Wallace. Dr. Andrea Wallace's research aims to enhance routine healthcare service delivery through the design and implementation of high-quality chronic healthcare interventions for vulnerable patient populations. Her research commitment has reshaped healthcare systems by integrating social resource information into clinical care. Welcome to the Academy. From the state of Vermont, Billy Allard. Ms. Allard is leading the transformation of healthcare delivery as part of a value-based payer model. Her interdisciplinary team is successfully partnering with community agencies to address the social determinants of health and meet the quadruple aim. Welcome to the Academy. Carol Ream Conroy. Dr. Conroy is a nationally recognized leader by creating structures to support innovation. She ushered in the establishment of an innovative model of nursing care for Medicare patients in rural Vermont, resulting in sustained reductions of readmissions and unnecessary emergency department utilization. Welcome to the Academy. From the state of Virginia, Suzanne Omringer. Dr. Omringer's research addresses symptoms, self-management, and quality of life in adolescents and young adults with cancer and sickle cell disease. Her groundbreaking research on fatigue in sickle cell disease was one of the first comprehensive studies in this population. Welcome to the Academy. Tim Cunningham. Dr. Cunningham has built bridges between the arts, compassion, and healthcare at a global scale. His advocacy and research on resilience begins with strength-based modalities that foster compassion in the stressful settings nurses face every day. Welcome to the Academy. Darrell Roberts. Dr. Roberts is a nationally recognized leader in health services research and quality measure development to improve healthcare delivery. He has employed the tenets of high reliability organizations to drive healthcare improvement and reduce nursing burden. Welcome to the Academy. Julie Strunk. Dr. Strunk's advocacy and promotion of child health, specifically impacting child health behaviors and environments, has directly affected the promotion of positive healthcare outcomes and facilitation of optimal development in behavior, socialization, and communication locally, regionally, nationally, and globally. Welcome to the Academy. Teresa Swift-Scanlon. Dr. Swift-Scanlon is a pioneer in epigenetic technologies that pave the way for personalized cancer interventions. Her science has created therapies proven in vitro and in vivo models to reverse cancer processes that are particularly prevalent in underrepresented populations. Welcome to the Academy. Clarine Winsick. Dr. Clarine Winsick has elevated the practice of acute and critical care nursing. Her expertise in integrating palliative care with critical care is nationally recognized. Welcome to the Academy.
From the state of Washington, Lisa Day. Dr. Day's work has changed national and international undergraduate curricula and nursing practice by presenting innovative approaches that integrate scientific, ethical, and practical knowledge. The culmination of her work was the book, Educating Nurses, A Call for Radical Transformation. Welcome to the Academy. Dawn Garson-Mox. Dr. Garson-Mox is a recognized leader in pediatric mental health and advocate for integrating mental health services into primary care pediatric settings. Her national efforts in education and organization leadership raise awareness with the aim of improving the health and wellness of vulnerable pediatric populations. Welcome to the Academy. Kathleen Johnson. Dr. Johnson is a leader in the development of a nationally standardized data set for school nursing. She champions leadership, provider competency, evidence-based practice, and structural empowerment to create systems of care in our nation's schools and equity for all students. Welcome to the Academy. Vincent Salyers. Dr. Salyers' enduring advocacy to improve health outcomes for vulnerable populations, implement policy, and develop solutions for underserved populations has made a difference for thousands of individuals across the globe that might have otherwise gone unserved. Welcome to the Academy. Elaine Walsh. Dr. Walsh is a leading expert in the areas of child and adolescent mental health and suicide prevention, which has impacted practice and policy for nursing and other health disciplines at local, national, and international levels. She developed a course on suicide prevention that is mandated for nurses in Washington State. Welcome to the Academy. Mayumi Wilgarote. Dr. Wilgarote's work, which occurs at the intersection of school nursing, interprofessional education, and collaborative practice, has enhanced school nursing's power to transform health, led to critical workforce development, and impacted changes in the academic culture for health professions education. Welcome to the Academy. From the state of West Virginia, Susan Bragg Light. Dr. Light has created innovative health interventions, described vulnerability theory, used by many, and provided access and opportunity to high-quality nursing education for many disadvantaged students in rural Appalachia. She holds 2 United States international patents for her work on a biomechanical breast model training technology currently in use worldwide. Welcome to the Academy. From the state of Wisconsin, Gina Bryan. Dr. Bryan's scholarship focuses on the treatment of substance use disorders and improved access to mental health services. She serves on the National Academy of Science, Engineering, and Medicine's committee evaluating the recent Comprehensive Addiction and Recovery Act, a public law aimed at alleviating the opioid epidemic. Welcome to the Academy. T. Heather Herdman. Dr. Herdman is an international nursing leader who has advanced nursing science by developing, refining, and integrating the conceptual foundation and ontology of the discipline. Her research addresses standardized nursing language, accuracy in nursing diagnosis, and clinical reasoning. Welcome to the Academy. Beth Houlihan. Dr. Houlihan, an early pioneer in ambulatory nursing, developed the standards of excellence in ambulatory nursing and redesigned the role of the ambulatory care nurse manager. Her career has been focused on creating high-quality, reliable systems of care and developing the next generation of nurses and healthcare professionals to lead in changing times. Welcome to the Academy.
Okay, you get to do this again. It is an honor to present to you the 2019 Fellows of the American Academy of Nursing. This has been a wonderful celebration of our colleagues' accomplishments, but the night isn't over yet. To continue the celebration, there are several affiliate receptions hosted throughout the hotel. The soiree and dessert reception will now take place 2 levels below us in the Liberty and Independence ballrooms. Please enjoy the evening. Thank you.